Embryo and fetal development doesn't always happen perfectly. Sometimes there are errors due to what happens to us in the environment, and sometimes people need medical assistance to conceive and carry a baby to term. So, teratogens are chemical substances or possibly infections that can cause specific birth defects. Now, different teratogens will have different effects at different times because the fetus and embryo are developing in different ways at different times. So, there are some times in fetal development that if you come across a specific teratogen, you won't see any effects. And there are certain times when you'll come across a teratogen that will come with very dangerous effects. So typically in the first and second week, the embryo isn't susceptible to teratogens because it's not connected to the female's body. So it's not taking any of her blood or connected to her environment. It's kind of free floating in the uterus. But if anything does happen in developmental issues, you end up with embryonic loss and a miscarriage. During the embryo stages, weeks 3 to 8, we can see some effects in the embryo due to different teratogens in the heart, the upper limbs, the lower limbs. And when we see it later in the fetal period, we can see that in the external genitalia, the teeth, the central nervous system when those are finishing developing. So some different teratogens include common household items such as alcohol, which can cause craniofacial abnormalities and fetal alcohol syndrome, tobacco, brain damage, as well as a cleft lip and palate, ACE inhibitors, which can cause craniofacial abnormalities, benzodiazepines or barbiturates that sometimes people get from their medical providers as sedatives. There are also some infections that can be teratogenic, like toxoplasmosis, which is an infection you might get from cleaning up cat litter or digging in a garden where cats might have gone to the bathroom. It can cause spinal abnormalities and brain dysfunction in the fetus. Chlamydia and hepatitis B, other sexually transmitted infections, which can cause conjunctivitis and pneumonia. And chickenpox, which can cause eye damage. So there's some less common ones: cocaine, which can cause placental abruption and cognitive delay, and then thalidomide. So that picture that you saw in the opening of the little boy with really stubby arms and stubby legs was caused by thalidomide, which was prescribed for morning sickness in the 50s and 60s. And incidentally, Canada kept thalidomide in the market much longer than the United States and the European Union because it was found that it was causing limb abnormalities in babies that were born to mothers who were prescribed thalidomide. So what happened is they tested on guinea pigs, which do have a similar system to humans, and there wasn't any effects. But unfortunately, once it was prescribed to women, they did see some very serious effects in embryos or in the fetuses that had developed during that time in their development. And so since then, Canada has also been part of a program where they've given monetary compensation to children who were born with limb deformities due to thalidomide. And one of the reasons was because Canada was so slow in taking it off the market. Another common infection teratogen is rubella, which can, if it occurs during the first 12 weeks of pregnancy, can cause eye problems, hearing problems, and heart damage in a fetus. And so women are often tested for rubella antibodies to make sure that they are immune to rubella. If they aren't, they're asked to stay away from certain situations where they can come in contact with rubella if they are pregnant and not immune. Same with chickenpox. So if women haven't had chickenpox or had the vaccine and become pregnant, they're asked, their care provider will recommend that they don't work or travel to high-risk situations like daycares or play groups where they might come in contact with somebody who's infectious with chickenpox. So also looking at some reproductive technologies, because not all people can conceive easily, and there might be some other technologies that are used to support a healthy pregnancy. So one is a Pap Smear, which is a sample of cervical cells, and they're taken and examined for abnormal growth, which typically would then lead over the long term to cancer. Now, Pap Smears are recommended as a normal procedure for females' reproductive health. And you would just talk to your care provider about how often they recommend that you go. There is also the Gardasil vaccine, which can help prevent against cervical cancer from the HPV virus, but it also does prevent against throat cancer, penile cancer, and mouth cancer from the same HPV viruses. An ultrasound is typically used in pregnancy to view the baby in the womb. This usually happens once or twice during the pregnancy, and then if nothing is ever a concern, not anymore. But it can be used in high-risk pregnancies to determine fetal position or the development of a fetus, or to use any follow-up if something was seen as irregular in an earlier ultrasound. So an amniocentesis is a sampling of the cells from the amniotic fluid from about 16 weeks or farther along to check for genetic abnormalities. And typically you wouldn't do an amniocentesis without any screening tests beforehand. So there are several screening tests, including blood tests and ultrasounds to check for genetic abnormalities. And if you screen positive, typically you'll be offered an amniocentesis. Now, prior to 16 weeks, you would do a chorionic villi sampling, which is a sampling of cells from the chorion, and you could do this from 5 weeks on to check for genetic abnormalities. But both of these tests carry the small risk of miscarriage, so they're not often offered without cause. So in vitro fertilization, which means in vitro in glass fertilization, they take the eggs out of the ovaries, sperm typically as ejaculate, but they can take it directly from the testy, mix them together in a petri dish, and then would transfer the embryo into the female's uterus 3 to 5 days later, or a different female's uterus if you happen to need an egg donor. They also do this procedure for purebred cows. I found out when I was teaching this a few years ago, where you would take purebred cow semen and purebred cow eggs, and then you would transfer the embryos into non-purebred cows to build a herd. Artificial insemination by donor, also known as intrauterine insemination, is where sperm is artificially placed into the vagina or right into the uterus by a medical professional. And this could be for many reasons, such as previously having a vasectomy, needing a donor sperm because you're a single parent by choice or a same-sex couple, or because the male partner has difficulties with ejaculating and assistance is needed. Egg screening tests and select eggs to be fertilized. Fertility drugs would be used to produce lots of eggs and are collected using a needle biopsy. Now, this would happen if there was a genetic disease that the parents needed to test for to make sure that their child didn't carry it, and or if there was a history of miscarriage due to genetic abnormality, so that you could test the embryos or eggs to make sure they were genetically normal before transferring them into the uterus. Testicular sperm extraction occurs when you remove the sperm via a biopsy of the epididymis. These aren't mature sperm, so you would need to use this in conjunction with IVF. And this can happen if a man has had a vasectomy or for several other reasons where their sperm maybe doesn't mature properly. Intracytoplasmic sperm injection is what you saw in the image at the beginning. And this is where they take one individual sperm and inject it directly into the egg. And this could be done for reasons like low sperm motility, and sperm aren't able to manually fertilize the egg. So gamete intrafallopian transfer is where the sperm and egg are transferred into the fallopian tube for fertilization. This doesn't occur often. And then assisted hatching is where a chemical solution is dripped over the egg to allow the sperm to penetrate it more easily. It's also done to help blastocysts possibly implant into the endometrium more easily. So it kind of just weakens the lining of the egg. So an embryo transfer occurs when the fertilized embryo at a day 3 or blastocyst stage is moved into the womb of a female, and it may be frozen or fresh embryo transfer after an IVF cycle. And then fertility drugs are used to induce ovulation for IVF or intrauterine insemination. And many ova can be produced at one time, and it can result in multiple births. When we're talking about reproductive cycles and challenges, it's also important to talk about sexually transmitted infections, because they can have both an effect on the developing fetus as well as affect the ability of a couple to successfully conceive a child. So during sexual intercourse, bodily fluids are exchanged. The fluids can contain STIs in the form of different bacteria or viruses. Some bacterial STIs are chlamydia, gonorrhea, and syphilis, so these are treated with antibiotics. And some viral STIs are HIV, HPV, hepatitis, and genital herpes. So HIV/AIDS is caused by the human immunodeficiency virus, which attacks and destroys helper T cells. Currently, HIV/AIDS is non-curable and there's no vaccine for it. However, with the current method of antiviral drugs, people are able to keep their viral load at undetectable levels, which means they're at a very negligible risk of passing on to a sexual partner. However, it's always important to use a barrier protection method when having intercourse with a new or untested sexual partner, as well as talk to your partners about their sexual history. Hepatitis B is one of 3 different viral infections, or hepatitis is a viral infection that comes in 3 different types, so A, B, and C. B is transmitted in the same fashion as HIV, so through bodily fluids. So you can get this from maybe dirty salon tools and or sexual intercourse. And it typically attacks the liver. Hepatitis A we typically get orally through things like contaminated water or food. Hepatitis B symptoms include flu-like symptoms, jaundice, and liver failure, and it can cross the placenta and infect the unborn child. So occasionally a person who is infected with hepatitis B can be asymptomatic and then pass it on to others without knowing it. But there are vaccines for both hepatitis A and B. Sometimes you get them in your regular vaccine program that you would do as a child, and other times people get them for traveling. So genital herpes is the same virus that causes cold sores, and it's estimated that about 1 in 3 sexually active Canadians has genital herpes or the cold sore virus. So it can be caused by either herpes simplex virus 1 or herpes simplex virus 2. Herpes simplex virus 1 typically likes to infect around the face, and herpes simplex virus 2 typically likes to infect around the genitals, but they can be transmitted through oral sex from the face to the genitals and vice versa. Symptoms can vary from case to case, so some people will have outbreaks very often that are painful, and other people will rarely have outbreaks. Typically, the symptoms include itching, tingling, and appearance of blisters, which then may rupture and become painful sores. And these painful sores, unfortunately, can increase the chance of HIV infections as well as other infections because you have an open wound. Outbreaks may be accompanied by swollen glands, aching joints, and fatigue because your body is fighting a viral infection. And very seriously, a herpes virus may infect babies during the birthing process, possibly leading to blindness, neurological disorders, or death. So if you do have a genital herpes infection, it is important to talk to your care provider because they can provide you with antivirals for your genital herpes, which can reduce to a very negligible rate the risk of transferring on to your baby. So there is no cure for herpes. However, they are working on a virus or a vaccine to both prevent and to reduce the risk of having an outbreak and spreading the infection. And even if an infected person is not symptomatic, they can still pass on the virus during intercourse and other methods of sexual interaction, including anal sex and oral sex. But as of yet, like I said, no vaccine is available, but one is being worked on. Many are being worked on. So HPV, or the human papillomavirus, is the name of a group of viruses that's transmitted during skin-to-skin contact. Some people infected with HPV develop genital warts, where other people have no symptoms at all. But the HPV that causes genital warts typically does not cause cancer, but cervical cancer is one of the primary forms of cancer in women. So there is a an HPV vaccine. That is one of the routine vaccines that children in Alberta get to help prevent the risk of cervical, anal, penile, and oral and throat cancer due to the HPV virus. So chlamydia is one of the most common bacterial STIs in Canada. Infection rates are twice as high in young women than young men due to the way intercourse occurs, where things are actually inserted into the vagina. They're more likely because fluid stays in their body longer that could be contaminated with the chlamydia bacteria. Symptoms are often immediate and include discharge from the penis or vagina, burning or pain during urination, or fever. But 75% of infected people don't show any symptoms. Seriously, in women, the infection may lead to a pelvic inflammatory disease, which can cause scar tissue of the fallopian tubes, which can lead to infertility. But it can be treated with antibiotics, so it's important to get checked with your primary care physician. Gonorrhea is often found together with chlamydia bacterial infections. And again, for this one, the rate of infections in men is higher than women. Similar symptoms to chlamydia with burning during urination and discharge, but it can also lead to pelvic inflammatory disorder in women and serious eye infections for babies born with mothers to gonorrhea. So it's important to get tested and checked and treated if necessary. So syphilis is much less common than the other bacterial STIs, but in Alberta it is experiencing outbreaks at a higher than usual rate in the last several years. And syphilis was initially, you have ulcerated sores that are known as chancers that can occur in your genital region. Then they'll end up going away. So people are like, oh, yay, it's gone. But then you get a rash, often on the palms of your hands and the soles of your feet. Then it'll go away and people are like, oh, yay. But then the bacteria will affect your cardiovascular and nervous system, which now is a big problem. And it's known as tertiary syphilis, and you can become mentally ill, blind, develop heart disease, and at this point it's untreatable. So again, important to get tested and checked when necessary. If a bacteria infect a developing embryo, often birth defects or stillbirth results. So very serious condition. However, again, it can be treated effectively with antibiotics. Now, there are many ways to reduce the chance of passing on STIs. The most obvious one and successful one would be abstinence. But other than that, being in a long-term monogamous relationship using barrier methods such as condoms, and personal responsibilities such as getting tested and treated with your primary care physician and talking to your partners about your sexual history. Well, that's the end of the unit on human reproduction and development. I hope you enjoyed it. Take care. Bye.